Hello everyone, welcome to this session. We are going to talk about the postpartum mental health of women specifically, and we will be talking a lot about postpartum blues and postpartum depression. We will differentiate between these two um, terms, and we will talk a lot more everything related to the mental health of women after childbirth. And we have with us Dr. Ruhi. She is a consulting psychiatrist. Yeah, let me. Hi, Dr.
Hi,
Ruhi.
Nilima. Hi, how are you?
I'm good. How are you?
Very well. Audible? You can hear
Yes,
me clearly?
perfect. Perfectly.
Perfect.
Yeah. Hi, Vidya.
Hi,
Um,
hi, hello, Dr. Ruhi.
Hello, how are you?
Good, good.
That's nice. All new moms are good. So great.
Yeah,
Yeah. So, okay, I was just introducing you. I was just giving a brief introduction about you before you joined Dr. Ruhi. So, Dr. Ruhi is a consulting psychiatrist. She's practicing currently out of Mumbai. And it's not only the work that she does in her clinic, but everything else that she does for the society. That is something that I myself appreciate a lot about her. She is uh,
Thank you.
she's just a fabulous person, and she's doing what she believes in. Okay, so she really cares about the mental health status of all people, but especially of women in the postpartum period. That's why when I approached her for new mother, she was the one who directly jumped in. She is one of our expert panel member, and she is just an awesome person. I mean, the words will fall short if I have to describe how lovely you are, Dr. Ruhi. It's just like, a
How
pleasure
sweet and
knowing
nothing.
you. I have really been delighted and so happy to know you. And
And
thank
to
you
be
so
honest,
much for
Nilima,
taking out
very, very
time and
neutral.
joining us
I
today for
feel
this class.
amazing whenever I connect with you too as well. So I always look forward to, when we talk about ideas and when we talk about, how we can do something good. And I love your enthusiasm equally. So there's a reason we are connected, right?
Okay,
thank you so
so
much.
Thank
So,
you.
without further delay, let us start off. Today's topic of discussion is postpartum blues versus postpartum depression. So, my first question to you is, what is the difference between these two terms? I would not term this as, I will not term them as anything. I would love you to describe what is the difference between these two.
Sure. Okay. So when we talk about postpartum, we talk about the period after delivery, right? In postpartum, there are different weeks that we talk about it, initial 1 to 2 weeks, and then we divide it into after that. So when we
Mm-hmm.
talk about postpartum depression and blues, some of the symptoms overlap. That is a major reason why we have this confusion. You must have heard that people say, सबको होता ही है, थोड़ी देर डिप्रेशन आता ही है, and sometimes what happens is patient actually has postpartum depression, but the mother-in-laws or the elders in the family will be like, it's postpartum blues, you don't need to worry, sabko hoga, it will pass. Right? So
Yes.
this is the major problem that happens in these cases. So if I have to talk about classification and scientifically dividing it, that when it is blues and when it is depression, I have to first of all talk about the time frame. The postpartum blues start a few days after delivery and stay for 1 to 2 weeks, and then they start weaning off. The symptoms start weaning off on their own. Whereas the depression starts, it can in the first 2 weeks, but higher chances are it will start after 2 to 3 weeks and then it stays for a longer time. That's the first distinction. That when was it that these symptoms actually started, in your system? Sometimes it is recognizable, sometimes people don't realize because there's so much happening post delivery, so sometimes they're not able to pick the timeline. That's okay, but this is in most of the cases they're able to make it out that I was fine, I came home, I was happy about the baby, and suddenly I don't feel okay. All right, that's the first distinction. That first 2 weeks we talk about blues. If it continues after that, it is postpartum depression. When it comes to symptoms, of course, because it is blues and depression, we talk about sadness. But the level of sadness and the thoughts behind those sadness are a little bit different in both. In postpartum blues, we will have, general sadness. In between, you'll feel like crying. You won't even know why you are crying. Then suddenly something will happen little bit. It can be as simple as somebody dropped the vessel and you just feel so overwhelmed that you feel like crying. So the overwhelm is more of a feeling in postpartum blues, whereas in postpartum depression, it is sadness. It is a feeling of worthlessness. It is a feeling of, not being able to measure up to what is needed, feeling that I'm not a good mom, feeling that I won't be enough. All these things add up in depression. Whereas in blues, it is more of, I'm irritable, I'm overwhelmed, nothing is going my way because, we are used to being a certain way. And when the baby comes, there is so much happening. We have so many things going on. We have so many opinions coming on our head. And of course, we have just now gone through a major surgery, which people don't talk about. See, if you, even if, let alone men, we don't even want to compare with them. But if you remember your own life, even if you had like one or two stitches in your life, we literally talked about it all our life that, oh my God, I had that accident at that time and, I got two
Yeah.
or three stitches. So we were talking about pregnancy. I know that, I had a major surgery and delivery and quite honestly, I never talked about it. I was fine, I had a baby. It was all about the baby. It was all about, the photograph that we had to take care of the baby. Why is he crying? Why is he not crying right now? So all these things, we never talk about it. And that itself is a major surgery. You literally go through, even if it's a normal delivery, it's huge. If it's a cesarean, it's another topic already, right? But we don't get to talk about it. And nobody cares for you. Yes, your mom will, but the way they would have if you have got just those two stitches would
Yeah.
be very different, isn't it? So that's the
Yeah.
irony of becoming a mother. So that adds up. That stress adds up. We forget about it. Yes, mentally, we are under the influence of oxytocin hormone, which creates all these lovey-dovey feelings. So we forget about what we have been through. But that doesn't mean that the body has forgotten. That doesn't mean that the process that is going on in the body is not there, and we have a mind-body connection, right? So physically, if you are exhausted, you don't get to sleep. There is, insomnia happening. There can be sleeplessness because of the baby, and some people actually cannot sleep. So these add up and create all these feelings of stress and anxiety, feeling restlessness. You snap at the tip of the finger, something happens, and you are irritable. These are all blues, right? Now take it one level up,
Mm-hmm.
one level up where you don't even know nothing happened and you're just crying all day. Nothing happened and you're feeling that you're not good enough, that you have done some mistake or the baby is unlucky that you're a mom. These are common thoughts that I hear from these females, unfortunately. Right? We talk about irritability, anxiety, but to a level that it can continue throughout the day, unlike the bouts of anxiety that we have in postpartum blues.
Okay.
Then we can have the feeling of, sometimes if it goes really severe, we can also, rarely, but yes, we do encounter the thoughts of harming the baby. We feel that, I am not good enough. If I leave, then the baby is not there. And very rarely, yes, of course, thankfully with the awareness, we're able to say, but it was very recent. I think few months ago, I read about it that the mother was under postpartum depression and she unfortunately, died by suicide. And then she
Mm.
killed her baby as well, along with that, because,
Oh.
in whatever state of mind she thought maybe the baby is better off if he leaves with her. So the husband had shared, and he's actually doing very good work about that area. But this was very unfortunate incident. It was a clear case of postpartum depression where the negativity or the negative thoughts become so much that you just don't know how to come out of it unless recognized at the right time and treated at the right time. So that's the difference.
Thank you,
Yeah.
Dr. Ravi, for explaining it so well and so elaborately. Continuing on the same question, I just want to ask you, is it like, as you mentioned, that postpartum blues and depression, we understood, what are the differences, what is postpartum blue and what is depression. So we said the time frame for postpartum blues is in the initial 2 weeks or something, and then postpartum
Right.
depression kind of like, usually later on. Is it possible that a woman has postpartum blues and then it continues to become postpartum depression?
Yeah. So basically, that's what if the patient comes within the first 2 weeks, we will of course check the clinical signs if the psychiatrist is very well equipped to see whether it is blues or depression. But even if you don't, what we check is these signs of worthlessness. Like I said, those dangerous thoughts or the level of negativity that the person has. So it's very important to see the symptoms physically and what they are describing. Along with that, it is important to do a psychological profiling that, what is the level of the negative thoughts, what is the depth of their thoughts that are there. That will give us a lot of idea about what is the difference. Because like I said, in postpartum blues, it is more about the overwhelm. It is more about not being able to manage the situation or falling short. Whereas in postpartum depression, it's literally like, I'm not good enough. I'll never be able to take it. A lot of hopelessness and helplessness and worthlessness, which is very typical of depression. So that is how we know. So timeline might it not be very, very crucial. Of course, it makes it easy to differentiate, but that is not the only point that we are going to use to diagnose the patient.
Okay.
Thank you, Dr.
Yeah.
Yeah, what are the common trigger points, for postpartum blues or depression? But
Right.
and I just want to add on to this. Nowadays, we hear a lot, from elders saying because of nuclear families, this depression has increased. I'm not
Yeah.
sure how much true it is for that,
Yeah.
but is that the only reason for depression rates going high?
Yeah, is that also one of the reasons for
Right.
Yeah.
depression? Yeah.
I got your question. So, statistically speaking, yes, that could be a reason because in nuclear families, the pressure adds up. But to be honest, if I see practically, statistics tell that, but practically living in a joint family is also not easy. If we talk with experience, I have seen that most of the people who are in nuclear families find it easier to deal with the situation because they are much in control of it. Right? So it
Right.
happens in the cases where the woman herself is not equipped to handle the situation, right? For example,
Right.
if you talk about a financially independent woman who has all the shots in the house, she is definitely going to feel better if she is alone. But if it's a housewife who has to depend on, the husband for every decision, for every financial investment that she's making, even if she has to, sometimes buy a toy, she has to ask the husband. At that time, of course, it becomes tricky. And then, you're taking care of the whole household and then you're taking so it totally depends on person to person because everybody has their own share of, struggles going on, which we don't
Issue.
even know from outside, right? So that's one thing that adds up. Definitely, nuclear family can be a stressor, yes, but that's not the only criteria. Main is biology, right? Genetically, some people are more prone to these hormonal imbalance. For example, we hear about gestational diabetes. I think a week ago you had that topic. So you don't need any diet issues to have gestational diabetes. It's just purely, your hormones and genetic playing that. It's not like
Right.
somebody who is only on an unhealthy diet or only obese will get diabetes. Somebody with a very strict diet also can get gestational diabetes. So pregnancy has a different set of impact on your body, and there is always your own genetic background based on that. Apart from that, one thing you mentioned nuclear family, there is also, the fact that maybe you have some work structure that is very difficult to handle. For example, I know that I was working till the day of my delivery and I started working 1 week later, despite of having a cesarean section. But I did that because I had a support system. Now, for most of the people, they can't, right? They don't have a support system, but they can't also quit the job because, they have to earn. They have that financial urgency that they need to. So we need to consider multiple factors here. It's not that, because we are staying alone, it's happening. Maybe for her, leaving the job and going and staying with family is a bigger stressor than, handling all of the things and working. To be honest, that was the choice that I made. It was very easy for me to quit everything and just, for a year, I could have stayed with my family. I can't even, think of doing that. That sit at home and not do anything. So that's a personal choice, right? So that's also a stressor that adds. Apart from that, your own physical health. Sometimes, you have nutritional deficiencies. You have sleep issues that add up to it. Insomnia, to be honest, is one of the major triggers that you're not able to sleep better naturally. In anxiety and postpartum depression, what happens is that level increases. I literally know of people who wouldn't sleep for a week, maybe 1 or 2 hours of sleep. That is going to play on your mind. And the difference now, just one point that I'll add is if it's postpartum blue, insomnia is mostly going to make you irritable. You'll be irritable and overwhelmed. If you have depression, you'll literally be mad. you'll go angry, you'll get frustrated to a level that you are not able to handle what is happening throughout the day. That is also one of the trigger, signs that we use, whether it's blues or depression going on. So if you feel that it is overwhelming you so much that you literally go mad and you're yelling, howling, and even hurting yourself for that, something to consider, that you need a professional. So this is also something that you need to see. Apart from that, of course, the lack of exercise and environment that you are in.
Mm.
If you're staying at a place where you have little bit of peace, some people, for example, Mumbai, we are this much houses, and then we are living on the main SV road and we have all that noise, it's bound to make you stress. So environment matters a lot. And then of course the personal thing that you're doing. For example, of course, first 2 3 weeks you can't do much, but after that, little bit of exercise, little bit of me time, even if it is 15, 20 minutes or 30 minutes a day, that has a huge impact on your health. But unfortunately, because we are moms, when the baby is sleeping, we are working, and when the baby is awake, we are taking care of the baby. So we don't know how to strike that balance. That adds up to it. So it's not just the fact that even in the whole joint family, it is possible that you won't get 5 minutes for yourself. So that's not so much of a thing. But these things add up, and of course, take your supplements. If many people just ignore, like myself, I never had them, I should have. But we forget about ourselves, right? We know the vitamin D and B that we have to give for a baby, but we never remember the capsules. They're all lying there. So yes, but that adds up to it. Vitamin B and vitamin D deficiencies are the most commonly associated with depression and anxiety. Something that you need to consider in that case as well. In fact, if a patient of depression comes, vitamin B and D is something that we get checked to make sure that they are not the reasons that they are having depression. So we need to see in that
Okay.
way as well.
Okay.
Yeah.
Yeah.
Nilufar, do you want to ask any
Yes,
questions from the
actually,
student?
yeah, we have a few more questions, I guess, right? But we have a lot of questions from, people. I had posted a
Yeah,
story
let's
in the
ask.
morning, and there
Yeah.
was a lot of inflow of questions. So before closing on our questions, if we can just summarize what we wanted to ask you for the remaining of our part. It's like mainly how can women prepare themselves? Okay, see, postpartum blues and postpartum depression, as far as we understand, it can affect anybody, right? It does not see any kind of status or any other thing related to that woman. Okay, so it can happen to any one of us. Now, if
True.
that is bound to happen to us, the statistics also show us that there are, there has been an increasing number of people who are facing these issues nowadays, whatsoever the reasons are, as we discussed right now with you. So if we know that there is a high chance of, say I am pregnant and I know that there's a high chance that I may suffer with postpartum depression, what are the things that I can do to prepare myself? Okay, maybe I can create a support system for myself. I don't know. I want to know it from you. What are the things that I can do in advance, okay, before even giving birth to my child, just so that if at all it happens to me, I am prepared to handle it. I cannot really solve it maybe by myself, but at least I will be able to handle it. And one more thing over here, along with this question, some women believe that if they prepare, to handle postpartum depression or anything related to postpartum mental health, it may actually lead them into it, just by
Yes.
knowing about it. That's a very, I would love you to answer that, how to handle this, how to make women understand that this is something that you really should know, and knowing this is not going to cause you postpartum depression. You do not and how you can prepare for it.
This myth that people say that knowing it will cause also comes from, like you are mentioning again and again, that statistics tell that the numbers are increasing. To be honest, yes, statistics do show that the numbers are increasing, but what are stats? Stats are the number of people that walked in a OPD and the doctors informed, right? The fact is also that because of this knowledge, people are realizing that they have depression, which they never did. They suffered continuously throughout their lives. They tortured themselves, they tortured their families. if there will be time, I'll maybe discuss a few cases where you will understand the impact of not knowing, right? The damage, like we discussed one thing, right? That we had a lady who unfortunately killed herself and the baby because of postpartum depression. So knowing is important. Knowing is essential. For example, if you have a baby, you want to get an ultrasound to make sure that something is okay. Do you say कि अरे ultrasound करवाएंगे तो कुछ तो हो जाएगा? Prevention is better than cure, right? So knowing that what are the possibilities and what are the things that we can do about it is important. That is why the doctor gives you supplement. That is why the mothers tell you to have a diet. They tell you to eat ghee. I don't know why, but then we have to eat ghee while pregnant, right? Why do you do that? Thinking that it will help in delivery, right? God knows how much it does, but that's the notion. But we do that, right? So what is the problem with knowing about depression, right? It's vital that you know something about these things, because if God forbid it happens to you or somebody around you, you are able to pick up. You are able to help them as soon as possible before it becomes so difficult to treat. It takes longer to treat, more difficult to treat, more interventions are required, which are just unnecessary if they would have come on time. That's my first answer, right? Now, the second part of the question was, what can we do? So whenever we talk about mental health disorders, we always talk in three aspects: bio, psycho, social. Bio is your own biology. Psycho is your psychology. What are you as a person? What is your personality, your temperament, etc. And social is your environment, right? So biologically, what can we do to prevent depression? Eat healthy, eat more of the fruits, which increase the level of serotonin, which reduces actually in depression. So raw fruits, boiled food, and then on top of that, vitamin B and D deficiencies, like I mentioned, are causative. So try to have the proper supplements to prevent that. That's the biology. Do a lot of exercises. Exercises are known to increase the positive hormones, which are, endorphins and serotonin, which will, of course, if they are increased, you cannot have depression. So it's not 100% guarantee that it won't happen. But likely, even if you have a diabetes in the family, they'll tell you to maintain your diet so that you don't get it. So same, if you have a family history of depression, it's important that you start working on yourself so that you reduce your chances of getting it. That's the biology part. Psychologically, of course, if you are somebody who tends to get anxious, tends to get, a little bit reactive, good time to start therapy. I work with Cloud9 Hospitals, which is a maternity setup, and to be honest, I feel really happy when we see patients who don't have any depression or anxiety, but they want to work on themselves because they know they have some patterns. Some people have anger issues, some people have relationship issues, which they don't want once the baby comes. So these days I see a lot of proactive therapy sessions where they just come and take a few therapy sessions to work on some of their issues that they're having, which they don't want to affect the baby later. So that's amazing. That's the psychology part. And social is, like you said, having a good community aspect of it. So maybe family members, friends, maybe just joining some online community. You have a wonderful one. So joining some support system, right? Something where you can lean on, because it will. And sometimes we have the whole family around, but it's not something that we can talk to them about. Sometimes there are things that we can't share with the family members. So having some sort of a backup, having some maybe a therapist on the side, or there are so many online communities these days. I know that you have created one. That's a wonderful effort. So just join them and be there, because see, women will understand you better, and
Right.
especially the ones who are going through the same journey. So these are some things that you can do, be informed. For example, I didn't need online communities because I had my sister. She's a doctor herself, and we became mothers very close. So, she's just 2 months, 2 year gap, 6 months gap in pregnancy. So it's literally like I know that even at 4 a.m., if my baby is crying, I can simply just call her and ask her. So that is the level of support you have. And everybody should have that. I know how much of my life became easier just because she was there. She was informed, she knew, and then she is also a mother. So even though she was a doctor, she knew all the knowledge part of it. But then going through that same journey along with me, now we discuss everything. So that definitely helps. So you should have that level of a support system. And then just one warning I'll give is, sometimes in these online groups we hear a lot of weird advices. So I'm a part of many such WhatsApp groups where sometimes the people give advice and I'm like, okay, what is happening? But then I can't go on, saying anything negative on the community. But then something to think about. So you take the advice online, but if it is something technical, rely on a professional rather than somebody who doesn't know what they're talking about. फॉर एग्जाम्पल आई ऑलवेज से कि इंडिया में डिप्रेशन का इलाज डॉक्टर्स के अलावा सबके पास है. Nobody will go to a psychiatrist. Everybody knows how to treat depression except a psychiatrist. They'll go to a psychiatrist in the end. That's the irony. And same happens with pregnancy. I see that people, some doctor has advised cesarean and they don't take advice from. It's okay. If you don't like your doctor, change the doctor. But go to a doctor. How can you just go to a layman for such opinions? I don't understand. मतलब मुझे अभी बैंक में कुछ काम है तो मैं रेस्टोरेंट जाके थोड़ी पूछूंगी कि अकाउंट कैसे खोलना है. I'll go to another bank if I don't like this one, right? So that's it's weird. I don't know. So I always tell my patients, if you don't like my opinion, it's fine. Don't come back to me. Go to another psychiatrist. Don't go to some Baba or some, other alternative therapies one. Go to 5 psychiatrists if you have to. Go to 10. Then take the opinion that you like. But if it's a mental health issue, go to a mental health professional. Don't go to somebody else. So that would be my humble request, and I'm sure that it would save the lives as well. So something to think about.
Thank you, Dr. Okay, Vidya, shall I switch over to the questions which people had? There are a lot of questions.
Yes.
Okay.
Yeah.
Maybe Dr. Ruhi, you will have to try and answer them like in just 1 or 2 sentences because there are a lot of questions. I will start reading them out one by one. Okay, the first question we have is how to deal with the postpartum depression when your baby is not ready to leave you.
Could you, Nilofer, could you repeat the question? Your voice was cracking.
Yeah, I'll repeat the question. How to deal with postpartum depression when your baby is not ready to leave you?
Not ready to leave you. Leave her.
Okay. Why would the baby leave you? In fact, it's a good thing that your baby is there with you. You have somebody who is loving you unconditionally. That's what we need in depression, right? See, you need to understand that the only person you need to come out of depression is yourself. You need your psychiatrist, you need your therapist. Baki family and all is good if you have them, but even if you don't have them, they're not going to make major difference. Go to a professional.
Is there disconnect from my end, Vidya and Dr. Rumi, because I am not able to hear you clearly.
I'm able to hear her. I think because the headset dropped a little low voice.
Maybe try connecting that, Dr. Ruhi.
Yeah, it's connected only.
Yes.
I think there is an issue because of the headset, because there's a lot of disconnect in your voice.
No, Nilofer, I'm hearing that from your side as well. I think it's a network issue more than a headset issue.
Okay.
Yeah.
Okay.
Yeah.
Yeah, I think we can go to next question.
Yeah. To whoever has asked that question, right? First of all, I did not hear what Dr. Ruhi said, but if you are saying that you have postpartum depression, have you really consulted a psychiatrist? Because you cannot diagnose for yourself that you are suffering with postpartum depression. There are n number of postpartum mental health issues. So the first step, I think, you need to talk to a psychiatrist, because if you would have spoken to a psychiatrist, you would know how to deal with the baby, right? Because the person would have actually advised you for it. And also, Dr. Ruhi takes online consultations. You can feel free to reach out to her. We will be sharing her Instagram profile details in the post, in the live session that we will be posting on our Instagram profile. If in case you're not able to reach me, you can contact us and we will redirect you to her. Okay, I'm just moving on to the next question now. My milk supply is low, what to do? So this is something related to lactation. If you want to say something, Dr. Ruhi.
No, that's totally unrelated. She has to go to a physician, or there are some supplements that she can take for that, but the gynecologist or a physician will be able to help her in a better way.
Yeah, to answer that question again, we have a lot of lactation consultants on board with us at New Mother, and if you can contact us, just send us a direct message, and we should be able to redirect you to the right expert. Okay, because if your milk supply is low, there can be n number of reasons for it to be low, and a lactation consultant is the best person who can help you. Third question is, in-laws are taunting on everything. It's so depressing. Would you like to answer that, Dr. Ravi?
like I said, the nuclear family, joint family dilemma. So you need to understand that I have a very famous line which I feel embarrassed in sharing, but I'm going to. I feel that in-laws are only in your life because there are laws involved. Otherwise, it will be very easy to chuck them out. So I hope none of my in-laws are watching. But then, yes, that's what I feel. So you need to understand that you can't change them. You can only change yourself. Keep your distance. इधर से आने दो इधर से निकाल दो don't take it in as much as possible, try to ignore. But if there are major issues, maybe talk to a therapist. You can go for a family therapy session, or you can just start on your own where you learn how to deal with them, because of course they are your in-laws, they are not going anywhere. So you need to learn how to cope up with it. So if I can't answer here because it's literally like a therapy session, you'll have to tell me specific scenario of what is happening, so I'll be able to help you in a better way how to deal with it one on one. But yeah, just take a help of professional. Otherwise, just communicate to them that whatever you are doing is bothering me. That always helps, be open about it, be talk about it. But yeah, in a respectful manner, because I think, yes, they're taunting, but in their way, they think that they are helping you. So that's something that you need to consider. But of course, if it is overwhelming for you and if you feel that, it is some way blocking the way you want to take care of your baby, take a stand. Just speak about it. When it comes to the baby, never worry about what the other person will think. So I think as a mother, you need to start learning that you will have to stand up for your kid.
Best advice. Thank you, Dr. Ruhi. Okay, the next question is, I am having leg pains after pregnancy, C-section. Is there any solution for that? Again, this is not related to the topic that we are discussing, but if you want to share anything, okay.
Can you just repeat the question? I just
Yeah,
heard cesarean section.
she's having leg pain. She's having pain in her legs. She had a C-section. That's what she has given the
Right.
background. So she's asking for what she should be doing.
So first thing is she should go to back to the gynecologist and get the follow-up done. It could be because of the posture also, sometimes back pain leads to the leg pain as well. It could be some part of some post of complication as well. Sometimes because we are doing some cesarean section, it can happen that there is some nerve damage happening. So it's better to get checked. So we need to do a physical exam to be able to diagnose what is happening.
Okay, thank you, Dr. Ruhi. The next question is, hi, I am 37 weeks pregnant. How should I get to know whether the position of the baby is right or not?
These are not related to mine, but the gynecologist can very well, they know how to physically
Sorry to
check
interrupt you,
that.
Dr. Ruhi. Do you want me to eliminate such questions which are not really related to the topic of our discussion?
Yeah,
Uh,
just don't mention them.
yes,
I
yeah.
am not
So,
in a position to answer.
yeah, so I think let me move on to the next one. So then I have to just read through everything because there are too many questions today.
So,
Yeah. This one is 6 months postpartum and still having erratic mood swings. EBF,
right.
exclusively breastfeeding, and got my periods after 4 months. I am hating life.
Yeah. So if you're hating life, you need to go to a therapist. See, even though you feel that you have removed some physical symptoms of depression, it's clearly there in your mind. It is affecting you, and you need to consider going to a psychiatrist or a therapist. It's interchangeable, don't worry. But you need to go and see a professional, check yourself for signs of depression. Even if you don't have depression, clearly you need some therapy sessions to work on whatever issues are there which are making you hate your life. So trust me, the life is really good. You just need to help yourself a little bit to come out of this and you will see the beauty of it.
Yes, just adding to what Dr. Ruhi said, you are the best person who can help yourself. There's nobody else who can help you as much as you can help yourself. The moment you step out and talk to the right person, your most of the issues are going to be resolved. Plus, motherhood is difficult. Everyone has faced difficulties. All three of us are mothers. And recently, within a span of 2 to 3 years, we've had our babies, and we all can completely relate with you. Breastfeeding is completely a different journey, and it is different for every woman. So, if you are facing such things, then please, as Dr. Ruhi said, talk to an expert. If you want to, if you know anybody out there, just go and talk to that, like book an appointment and talk to that person. Or else you can also reach out to Dr. Ruhi. She's an amazing person. I'm sure she'll be able to help you out. I'm moving on to the next question, Dr. Ruhi. Uh, I feel so insecure about my baby. Even if my husband holds the baby, I feel they are going to separate us.
They're going
They
to.
are going to.
Separate us.
So see, okay, what you're talking about lies more on the lines of anxiety. Just get yourself checked for anxiety, because sometimes when you have anxiety disorder going on, you start having these thoughts of something can go wrong, and this something can go wrong take a lot of forms in your head. So whether, and second aspect also could be whether you have some relationship issues going on, because of which you feel that if your husband has the baby, you feel that they are going to separate you two. So I would really request that just go and talk to a professional, just sort it out what is going on. If it is purely anxiety, you will need some medication, little bit of therapy, it will help. If there are relationship issues, I would advise you to start with family therapy, the couple counseling, when we talk about that, where these beliefs and thoughts are coming from, if there is something, interpersonal going on that needs to be checked, so that can be very well taken care of, with some therapy sessions. So that would be my advice, that try to just go to a professional. And because in one line, I will not be able to tell you the whole solution. I need the details. But yes, if you're mentioning this, it is either interpersonal issues or somewhere on the lines of, anxiety or some sort of, disbelief going on. So just get yourself checked.
Yeah, I just want to add something here, Dr. Ruhi. In our last session, the last live session that we had with you, we spoke a lot about, the kind of stigma attached, okay, to mental health issues.
Yeah.
So women or men, people really do not come out in the open and talk about it, leave alone going and consulting an expert, a psychiatrist or a psychologist. So there's a lot of stigma attached to it. Now, most of the people have just written one or two lines. Okay, it is like saying that,
Yeah.
I have a stomach pain. Okay, that stomach pain can be for n number of reasons. It cannot be
Yeah.
like, doctors cannot really recommend you or prescribe you anything, advice or medicine, just you say that you have stomach ache. So all the
Yeah.
people who have posted so many questions, you have actually taken the first step. Why I'm saying this is because this is the first session on which we have completely an outflow of questions. It's like I don't even think I'll be able to cover it, even if we talk for another half an hour or something. We have so many questions.
Right.
It means people actually having issues. That is something
Yeah.
really sad. That is
Yeah.
actually, it's kind of making me sad that people are having issues and they are posting it here on the live session. We definitely want to help you, but if you are able to recognize this thing, if you are able to post this question, the next best thing
Yeah.
that you can do for yourself is go and talk to the right person. Basically, go and
Person.
talk to a psychiatrist or a psychologist. It can be anything: relationship, anxiety issue, depression, blues, whatever it is. Why do you want to really, suffer for something? This is exactly what we spoke in our last session. So you don't really need to suffer. I'll just quickly glance through
Very
other
well.
questions. Yeah, I'll just glance through other
I'll just
questions,
add
Dr.
to
Rohit.
what I said, the part of the stigma that nowadays we have online consultations. So, if you feel that your family will not understand or you don't have support, you don't need any of that now. You can simply just, go online, book a consultation, talk to somebody on phone. No one even needs to know that you are under treatment. It's that easy with online consultation these days.
Yes.
So if you feel that you are not somebody who has access to it, I think if you have a phone, you have access to the whole world. So
Exactly.
don't wait for things to happen for you. Just go out and get the help that you need.
Yeah, in fact, even after this session, if you're just going to send us a message, we will definitely redirect you to the right person who can actually help you out of your situation. And really, there's no reason for you to suffer. It's really not required, just to sit and keep thinking whether I'm having this issue or not. When you can
Yeah,
actually
just
clarify it just within, half an hour or 1 hour of a session. Yeah, the next question that we have is, um, I think I will, like it's I'll just ask you questions for another 3 to 4 minutes, and then we can end it because there are a lot more questions. Maybe I can pose those questions to you later, and like whenever you find you can reply, and we can send our responses to the people. So the one question
Sure.
that is here is how to decipher whether what I am going through is depression or mood swing caused by hormonal change. I think, Dr. Ruhi, you already answered that question in the first question itself. So you can just watch
Yeah.
the live session and you should be able to get the answer for that. That was the first
But if
question that
you're
I
still
had.
confused, just get it checked from the doctor. That's the easiest answer to it. You don't need to figure it out. You have doctors for that. For example, if you have fever, you don't sit and diagnose yourself. You go to a doctor and ask the doctor to check, right? Same with the mental health issues, no difference.
Okay. Yeah. The next question that we have is how to handle postpartum depression when there is no family except partner and he's stressed with work too.
So all the more reason that you need to handle first of all because you don't have anybody. So all the more reason that you are fine and you don't have to handle. You have a psychiatrist and a therapist that will help you handle it. So you need to see. You don't need to depend. Your family doesn't know what to do about depression. So why are you expecting that they should be there? All you need is a doctor. Just seek help there. The doctor will take care of you. The therapist will take care of you. You don't have to do it. You don't have to do any of it. If we get admitted to a hospital, we just lie down there. The doctors and nurses take over, right? Same thing here. So don't try to solve it on your own. Ask for help. It's all around.
Okay. I'm just moving on to the next question. Um,
No.
can it occur? I mean, I think the person who's asking this question means that can postpartum depression occur after 6 months postpartum, and when does it end?
After?
6 months postpartum, basically 6 months after giving birth to the baby.
Yeah. Definitely possible, and then we label it as depression only. We use a specific term of postpartum for the reason that we know that the initiation was because of some pregnancy hormone imbalance. So the treatment time changes a little bit, and also the duration changes. So yes, definitely you can have depression at any stage of your life. It's just, a way of understanding that what could be the reason that it has started. So we know that it's postpartum. So there were some pregnancy related issues involved. Otherwise, it's just depression. It can happen at any time, and you need to get treated for it.
Thank you,
And
Dr. Ruhi.
shall shall
Yeah,
I
I'll.
I
add?
think Vidya wants to say something, for just 1 second.
Yeah, sure. Yeah, we.
Yeah, is just to add on to the point, okay, which Nilufer and Dr. Ruhi mentioned, we talk to our friends, right? And we don't share everything with our partners or family members. It could be just simple as that, make a call to a expert. You can call a psychiatrist, and you need not say. You can just, feel good about it and not say. You can share anything and everything. So don't worry so much. And
Yeah.
yeah, and I once Nilufer, you have completed only one question I have.
I think
Yeah.
I'm not taking any further questions because there are lots of questions. I'm like actually losing the
Okay.
brain on scrolling also. Yeah, so
Yeah.
maybe you can ask.
Maybe. Yeah. It's a club question, Dr. Ruhi. So yeah, can men also get postpartum depression? Can they also have postpartum depression? And then
Wonderful
why is
question. Thank you for asking that.
okay?
Please continue the second part. Continue with the
Yeah,
question. Yeah.
second part is why is it, I mean, on a rise now? Didn't ancient times, during the ancient times, did no women have this, or is it just that now people are speaking about it openly?
Right. So again, thank you for asking these questions. Well, because we always talk about, when, of course, that is also not enough what we are doing for the women, but definitely we don't even keep the fathers in the picture, especially in our country. So postpartum depression, we don't use the term, we use depression in fathers, is a real thing because yes, the fathers also go through so much during the pregnancy, and especially this generation. Why is it on the rise? Because they are more involved, they are more aware, and they get diagnosed. See, I'll always point out to this that the problems were always there. Only thing is that there is a in males especially there's a shift in personalities, right? my father was great, yes, but if I see the last generation of fathers, they were not very well involved in the upbringing of the children. There was a lesser number, right? They had other things to take care of. And of course, there were joint families, so there were so many people to take care of the babies that the father's turn never came. But now, because we have nuclear families, the fathers have to take up a lot of multiple roles. They're earning, they're taking care of the mother, then they add, help to the baby. I know how sweet my husband has been through the process. So definitely, it's likely that they can get depressed because it's too much. It's too much for anybody. But the numbers are increasing, yes, one because of this same the nuclear family pattern, but also because they are more aware and they go to the doctor. So if you go to a doctor, we have to mention these many patients we have seen, so the government knows that it is on the rise. That's how the numbers come. So don't worry about the numbers. You worry about the fact. In fact, be happy about the fact that the people know and they get diagnosed. So that's a good thing that the numbers are rising, because that means more and more people are asking for help. That's how I choose to see it. But yes, definitely a valid point. Fathers do have, high chances of getting depression, and they do have these symptoms as well. Only thing is they never, realize it, and then they continue suffering. Yeah.
Sorry, but this another important question. What's the treatment procedure, yeah, for postpartum
Perfect.
depression?
Right. So the first thing is getting diagnosed. We need to get checked whether it is, some nutritional or a hormonal deficiencies like we have to talked about initially in the beginning. The second part is the treatment. Now, if it is mild to moderate, there are different levels of depression based on the severity of symptoms. So if it is mild to moderate, we talk more in terms of therapy. So medicine is never the first answer in case of postpartum depression if you are a feeding mother, because if you are feeding, you are producing breast milk for the baby. We will try to not give you medications because some of the medications can go through breast milk, and of course we don't want to unnecessarily medicate the baby. So medication we keep it as a last option. But of course, if it is severe depression, then we have the benefits versus the risk ratio. If we see that the depression is so bad that the medicine will not do as much harm as the depression is doing to your life and to your baby and to your family and relationships, of course the medicine becomes the first line of treatment. And second is, of course, the therapy. So in mild to moderate depression, I always start with therapy. In severe cases, we have to start both together. So the ideal treatment is medicine plus therapy. And if it's, of course, mild to moderate, you don't need medication, or maybe you need medication for a few days and then we just, take care of the symptoms and we stop the medicine. That is how it goes. So, and the best is that you do both of them together, so you are out once and for all. Otherwise, you take medicine, you don't work on, your issues, whatever were the triggers that were causing it. You don't work on it, then again, there are higher chances of that coming back. So if you can, manage, the best idea would be therapy plus medicine together.
Okay.
Thank
Yeah.
you, Dr. Ruby,
Oh,
Yeah.
welcome.
for
Thank you so much,
taking your
Dr.
time beyond,
Yeah.
actual that one.
So many
Thank you.
questions.
Yeah.
I know, but that's a good thing. If they have questions, that means that we are doing something that's creating value. So no problem. Always there to help, right?
Yes, yes.
Yeah.
Thank
Thank
you
you
so
so
much,
much,
Dr.
Dr. Ruby.
Most
Yeah, Vidya,
welcome,
you can.
most welcome. If anyone you see any relevant question, just post it to me. I'll answer personally. No
Yeah.
problem at
Sure,
all.
sure.
Yeah, we'll do
Yeah.
that.
All right.
Yeah,
Thank you so much,
that's
Dr.
it,
Ruby, for
Nilüfer.
taking
I
out
didn't have, yeah.
taking out time and joining us. It's like always, always, always a pleasure to have you with us over here at the live session. We get to know so many things from you. We learn so much, and I'm sure that all the sessions that we have done so far and will be planning in the future definitely are going to help people out there. Thank you so much for doing all that you have been doing, and it's just great knowing you. And thank you again for joining
Same
us
here.
today.
I love connecting with you guys. We should do this often so that next time we have enough questions that we can answer.
Yeah.
Absolutely. Anytime. Don't worry about it.
Thank you so
Thank you.
much. Thank
Thank you,
you.
everyone, for joining us.
Bye.
All right.
Yeah, bye.
Yes. Take care. Bye bye.
Bye.
Take care, everyone. Bye.
Yeah.